My name is Rajit Mehta. I'm the MD and CEO for Max Healthcare. It is indeed my pleasure to have served this sector in the last 18 months or so. So the question you really asked was, what value addition will Max bring to the healthcare industry? And there's a simple framework that we use, called 5C, because when you're handling a very large organization of 10,000 people, 2,000 doctors, 3,000 nurses, it's very important to use a very simple framework to tell them about what we stand for. The framework we use is 5 Cs. The first 2 C's are care and clinical excellence. That's really the core of what we do. So our first responsibility, obligation is towards the patient. Something we are doing in that regard, one is on new technologies. So for example, we have imbibed the international mortality monitoring tool. We look at several patient safety metrics. We monitor lots of infections. So the SPY is operational, the teleconsult is operational, the BCMA is operational to make sure that we are able to give the patient a very safe environment. The third C is, stands for compliance. As you know, compliance is very critical in the healthcare sector. Whether it is medical termination of pregnancy or PNDT or looking at biomedical waste is very, very critical for us. The next C is about cohesion. The best care can only be given to the patient if you have a cohesion between doctors, nurses, administration. And we call it our DNA. So get your DNA right. Unless you have these 3 people collaborating, you can't give the best. Nowadays, we are seeing a lot of patients coming to us with comorbid conditions. So let's say a patient who has a cardiac issue can have a diabetes issue, a kidney issue. So what we have done is launch what is called the MDT, a multidisciplinary team. So whenever a patient walks in, let's say for stroke, we get a MDT together. While there is a coordinating doctor, he will make sure all the people required, all the specialists required are able to attend to the patient, so the patient does not have to run from pillar to post. So lots of things. So for example, one of our key focus areas is oncology. As I said, oncology we are now perhaps the biggest in northern India, where the critical success factor is the quality of clinicians and the degree of subspecialization. So whether you have a special unit for head and neck separately, thoracic separately, GI separately, uro-oncology separately. So we are focusing on getting the right clinicians and the equipment in. If you look at orthopedics, for example, now traditionally you think orthopedics is about joint and hip and knee replacement. Actually, it is a lot more. It's actually a musculoskeletal design we're looking after, which means rheumatology, chiropractic, pain management, spine, as well as knee and hip. So we're looking at all specialties and saying, what can we do to sub-segment to get the best of the patient? So one of the promises we made on the ambulance side was in the NCR, wherever you are, once you call, within 30 minutes of the call, our ambulance will reach you. We are monitoring that very carefully. What it requires us is for us to be able to figure out how many calls come, from where they come, how to station the ambulances, in which part. So far, as I've seen the data, 86% of the time we're able to honor this promise. The other thing which we are going to now operationalize, not yet in operation, is 6 of the ambulances we are fitting with advanced cameras, defibs, so that we are able to utilize the 30 minutes, 40 minutes of time when it takes for the patient to reach the hospital to be able to save the life.